Competitions in any sport have been suspended until at least 8 being deployed to clear the streets of Iran in the next 24 hours. More global sporting events have also been affected. Games in the English Premier League, one of the world's most watched competitions in any sport, have been suspended until at least April, while 2 more Formula One races have been called off. But there's also been some better news perhaps on global markets, tensions easing there with indices in Europe and the US rising after historic falls yesterday. Asian markets closed in negative territory, though. Emma Hayward begins our coverage.
Closing for the foreseeable future. Spain is in the grip of the coronavirus crisis. And in Madrid, bars, restaurants and shops are being told they'll have to shut. Only pharmacies and supermarkets will be open from Saturday. Across Spain, a state of emergency.
The state of emergency is a legal tool, recognised in our constitution, to confront a crisis as extraordinary as that which now faces the entire world and our own country.
In Italy, where public life has come to a standstill, an entire nation, some 60 million people, remain under quarantine.
The desperation will not help us. We must have hope. We must be strong and wait.
Experts from China have arrived in Italy to help, bringing in 30 tons of vital equipment from Shanghai and experience on how they battled the outbreak.
Europe has now become the epicenter of the pandemic, with more reported cases and deaths than the rest of the world combined, apart from China.
Across the rest of Europe, measures to stop the spread of coronavirus are being ramped up. A ban on all public gatherings of more than 100 people is being introduced in France. Schools, universities and nurseries will all close from Monday. In the UK, top-flight football, including the Premier League, has been suspended until the beginning of April after several players and managers tested positive for coronavirus or are in self-isolation. And in a continent which prides itself on being borderless, some European Union member states are now imposing tight restrictions on one another, introducing border checks or, as in the case of the Czech Republic, stopping foreign travel altogether.
Of course, we all want to protect our citizens from the spread of the virus. So let's look together at how we can do that and how we can do it most effectively. Certain controls may be justified, but general travel bans are not seen as being the most effective by the World Health Organization.
It's no surprise then that businesses are already taking a hit. The airline British Airways has warned staff jobs will go as it prepares to deal with fewer people travelling. Attempting to put the brakes on this virus, it seems, is getting harder every day. Emma Hayward, Al Jazeera.
Neve Barker has been following the story, joins us live now. And so Europe is the epicenter of the pandemic right now. Spain announcing drastic new measures with a state of emergency. What does that mean for the country?
Well, yes, that state of emergency was introduced after 4,000 new confirmed cases were discovered in a very, very short period of time. What it means is that the authorities have the power to either tell people to stay at home, to potentially lock down districts or entire towns. Also, the authorities have mobilised the army to help them enforce this situation for as long as necessary. As far as we're aware, the state of emergency will last for at least 15 days, and already the first lockdowns have been reported. 4 towns in Catalonia, north of Barcelona, affecting 60,000 people. Concerns are growing also for the capital, Madrid. 2,000 cases going up there. Most of those cases being reported in care homes. So many are already debating the very near possibility of the capital experiencing some kind of lockdown. And also, borrowing from Italy, Spain has decided to close most shops apart from food stores and pharmacies.
And Italy, of course, is where we're seeing the worst of the outbreak here in Europe. They reported some new figures with 2,500 new infections.
Yeah, that's right. 2,500 new infections, and the death toll has gone up by the single biggest jump since the first reports of infections were first discovered. It's gone up by 250, bringing the death toll to more than 1,200 in Italy. This is, of course, off the back of multiple measures introduced by the government. It started off with Lombardy, where the financial capital, Milan, was put on lockdown. Other big cultural centres like Venice have been shut down. Then the entire country, involving 60 million people, were put under restricted measures. Shops, businesses told to close, apart from pharmacies and essential food stores. Italy and its government are basically saying, look, we're going to do this for 2 weeks and then we will review the situation. But of course, whatever happens in Italy will be watched very closely across the whole of Europe. People are really looking for a glimmer of hope there.
Thank you very much, Neve Barker, with the latest on that. I want to move to the Middle East now and focus on Iran. The security forces there will clear the streets of its major cities within the next 24 hours in a renewed effort to fight the spread of the virus. According to state TV, shops, streets and roads will all be vacated. Iran is one of the countries worst affected by the pandemic, with a death toll of 514 and more than 11,500 infections. The country is struggling with a lack of life-saving equipment and has asked for an emergency $5 billion loan from the International Monetary Fund. Well, Zain Basravi joins us live from the capital, Tehran. And so really, this is a country struggling to cope with a mounting crisis in terms of resources and medical supplies. And I guess that's really reflected in this new step, this decision to deploy security forces to clear the streets.
That's exactly right. If you tune into local television channels in the evening, you'll find that the shows are all dedicated to panels of experts, and all of them say the same thing, that the worst is yet to come, that the peak of this outbreak in this country is going to happen in the next 2 weeks. President Hassan Rouhani, over the past week, has been the target of criticism from people across the political spectrum who say he hasn't been able to get a grip on the spread of the coronavirus throughout Iran. 100 members of parliament earlier this afternoon sent a letter to the president imploring him to take over control from the health ministry and put himself directly in charge of the reaction to the coronavirus. But all of that may be unnecessary. Late last night, the Supreme Leader Ayatollah Ali Khamenei issued a command to the Chief of the Armed Forces, Major General Mohammad Bagheri. Now, Mr. Bagheri is the head of the armed forces, the regular army, not to be confused with the Revolutionary Guard. In that letter commanding the general to start a new task force, he basically issued an order to the military to start a new parallel task force, but this one with a much more militaristic approach, a much more military slant made up of primarily military officers. Now, what we're seeing is Mr. Bagheri, after the first meeting that was held earlier today, went on state television and made a public broadcast. In that, he said during an interview on state TV that in the next 24 hours, the military will take to the streets to begin crowd control, to try to enforce the government's guidance to limit movement of the population in different parts of the country. Now, it is a week to Nowruz, the Persian New Year. That's like Christmas and New Year's combined. People are out at shopping centers. They are out at bazaars. People are out on the streets, and largely, especially in the capital, most of the population has not been taking government guidance seriously. Now Iranians can expect this to have become a security matter to address a civilian public health issue that simply the civilian government wasn't able to get a grip of. Another thing that we should look at in the Supreme Leader's letter to the military commander is that he said that there is evidence of the fact that this is perhaps a biological attack, really fanning the flames of a conspiracy theory that the United States was perhaps somehow behind COVID-19 coming to Iran. It's something that senior political and military leaders have been talking about publicly for the last few days. Now, the Supreme Leader saying this sends a clear signal to Iranians that this is now a security matter and that one of Iran's biggest enemies, the United States, might be involved. So Iranians really have to get in line, fall in line, do what the government needs the people to do. But it has to be said tonight, I can tell you that on the streets of Iran, people are still walking around, there are still cars on the roads, and shops in several parts of the city remain open.
Thanks very much from Tehran. Zain Basravi reporting to us. You're watching the News Hour live from London. Much more still ahead. US and European markets recover some lost ground after their worst day in over 30 years, but Asian stocks have yet to rebound. China records its lowest daily infection figures since reporting began in January. And then later in sport, the first of 3 races of the Formula One season hit a red light because of coronavirus. Joining me now in the studio is Dr. Adam Kaczarski. He's an infectious disease epidemiologist from London School of Hygiene and Tropical Medicine. We are seeing a contrasting approach from countries around the world, also here in Europe. I want to talk about the UK government's rationale right now because their response has been dictated by this need to create herd immunity, which is the idea that if some of us catch the coronavirus, then it creates a sort of general protection for the population. Can you just explain this concept of herd immunity, first of all?
The concept of herd immunity is that over time, people who are exposed to infection will build some immunity to it, and that will reduce susceptibility and prevent potentially future outbreaks occurring in that population.
But how specifically does that work? So if someone who then has the virus or the illness is then in an environment where people have all been vaccinated against the virus, then that it sort of dies out because there's no one to pass it on to?
The idea really comes from our social interactions, that early on everyone infectious is meeting other susceptible people, but once this immunity builds up, each infectious person is more likely to meet other immune people rather than susceptible people, and that slows down transmission substantially.
And of course there's no way of knowing how long such a process would take.
As we've got some good idea for these kind of viruses, that immunity can build quite quickly after infection. The key question, of course, is how long it lasts afterwards. There's some evidence it may be 2-3 years for these kind of viruses, but that's currently not well understood.
Because we don't have enough information about the coronavirus, it's still something that we're learning about. So even if you've had the virus, you might then be able to catch it again.
I think that's what we're trying to work out. It's unlikely that most people would be catching it, immediately, but it may well be that, but over a couple of years, that situation does change. Yeah.
But currently, there's no vaccine available for COVID-19, and there might not be one available until early next year.
No, and the enormous challenge we face is potentially a vaccine may not be widely available for 18 months, and we've seen that there are some control measures, for example, in China, that work very well over a short period, but may not be sustainable. So we have this situation where we have to find ways that are going to reduce transmission over a period of time, but this accumulation of immunity could, alongside this, help reduce transmission in populations where we're seeing outbreaks.
But if immunity is relying on enough people within the population catching the disease. Now, here in the UK, they're saying it'll be about 60% of the population. Is it likely to be more, though?
I think the important thing to emphasise here is that it shouldn't be a case that we're expecting to sit back and let this thing happen and infect people. I think we really have to work hard at our interactions to reduce risk and reduce transmission. But we face this really tricky position that even those interventions may not stop this. And so even if we put things in place, we change our behaviour, we think about hand washing and kind of staying at home if we're ill, that may not stop this, and so it may ultimately be that build-up of immunity.
Are you saying that even tough control measures that are being taken, like cancelling big events, school closures, people working from home, that's not going to stop transmission?
Potentially not. We've seen
it just slows it down.
We've seen in places like China, which are essentially a full-on lockdown of a society, that does slow transmission. But it's not clear yet how effective the other measures might be.
So in the meantime, how much loss of life are we talking about?
It depends a lot on how effective we are at protecting risk groups. There's a lot of risk in older age groups, so I think we need to think really seriously about avoiding those interactions that can bring transmission to those groups.
Adam Kaczarski, thank you. Now, US President Donald Trump has been criticised for the lack of a nationwide testing program there in the US. He is due to address the nation in under an hour's time. A drive-through coronavirus testing station, though, has been set up in the city of New Rochelle, just outside of New York, where an outbreak of COVID-19 was detected last week. Well, live now to our White House correspondent, Kimberly Halkett. And Kimberly, there's been a lot of criticism and a great deal of complaint about people in the US, some people exhibiting symptoms, but they're not able to access a test for this.
That's right. We're hearing stories of people who have or believe they may have been exposed, calling their doctors, being told, come back next week. We don't have the test just yet. But we understand that is soon about to change. Not only do we know that there has been a so-called testing czar that has been appointed to try and not only expand the access to testing, but also to employ the private labs in this country that currently are not a part of the testing system, because up till now it has been a government centralized program. That is soon changing. We're watching very carefully. As you mentioned, the U.S. president set to appear within the hour. We expect that he may be declaring some sort of national emergency. It could be an emergency declaration, or it could be a disaster declaration. We're not exactly sure. He has these powers under what's known as the Stafford Act, and what this essentially means is it will be tens of billions of dollars that will soon become available to allow for a more coordinated federal response with state and local agencies. Now, in the midst of all this, again, it is the testing that this administration has really come under criticism for. In the last few moments, the House Speaker Nancy Pelosi speaking on Capitol Hill, saying that she has put together legislation that will be passed in the House of Representatives very shortly and then in the U.S. Senate that would really have three key components. She said testing, testing, testing. So essentially what this will mean is that up until now, the numbers of coronavirus cases in the United States have been relatively low, about more than 1,600, 41 deaths. But that could soon change. Those numbers could go up with the widespread access to testing that we expect will soon become available.
All right, thank you. Kimberly Harkett with the latest from the White House. And of course, we're expecting Trump to speak at 1900 GMT in about 40 minutes. And as the number of new infections continues its downward trend in China, other Asian countries are stepping up measures to limit the impact it's all having on their economies. Florence Louis reports to us now from Kuala Lumpur.
Major stock markets in Asia took their cue from Wall Street's overnight tumble on Thursday and extended their losses from the day before. Japan's Nikkei index plunged by more than 10% in early trade, but recovered to close 6% lower. In South Korea, financial regulators imposed a half-year ban on short selling, starting on Monday, the first time it's done so since 2011, in a bid to curb volatility.
It's going to be very hard to stabilize the markets. What we're going to need to see is the slowdown in the cases, and that's starting to happen in Asia. But I think you've got the biggest problem of the whole global markets is the U.S., which is so pumped up on low interest rates and so pumped up on share valuations that, it's hard for Asian markets to bounce back when there's what I would consider a pretty big overhang there.
Beyond the stock markets, more visible signs that the global economy is taking a hit. Singapore announced it will stop allowing cruise ships to dock with immediate effect. Gone are the large crowds at usually busy airports across the region, as people avoid unnecessary travel and countries impose entry restrictions. Several airlines have asked employees to take unpaid leave. In Manila, people were stocking up on essentials, a day after the Philippine President, Rodrigo Duterte, said domestic travel to and from metropolitan Manila would be suspended for a month. Analysts say the move may weaken economic growth, but many residents agree with the measure.
Manila being on lockdown is okay instead of the virus spreading. I'm in favor of it because it's better to do it now before they let us know that there are so many cases.
In Indonesia, the government has started a campaign to disinfect thousands of mosques to prevent the spread of coronavirus.
Here in Malaysia, there are concerns there could be a sudden spike in confirmed cases after at least a dozen infections were linked to an event held at a mosque on the outskirts of Kuala Lumpur 2 weeks ago. Health officials estimate as many as 16,000 people attended the religious gathering.
But amid the gloom, there is some positive news. China reported 8 new cases as of Thursday, the lowest daily figure since reporting began in January. South Korea too continued the downward trend, reporting more recoveries than infections on Friday. Florence Louis, Al Jazeera, Kuala Lumpur.
Well, in other ramifications, coronavirus is having a major impact on sport across the globe. The world's most watched football competition, the English Premier League, has now suspended matches until at least the start of April. Sahel Malik has more on that.
It was a health update from this Premier League manager that finally forced the world's most lucrative league to take action. Just hours after it was announced that Arsenal boss Mikel Arteta had contracted coronavirus, an emergency meeting was held in London.
I think it's a very good decision. We've got great league management. They made the right decision.
Are you confident that the Premier League season will go ahead as of April the 4th?
None of us know. We'll see.
Arteta wasn't the only case. Chelsea star Callum Hudson-Odoi was the second EPL star to announce he tested positive. And like Arteta, the teenager is currently in isolation.
As you may be aware, I had the virus for the last couple of days, which I've recovered from. I'm following the health guidelines and self-isolating myself from everybody for the week. I hope to see everybody soon and hopefully be back on the pitch very soon.
The move to suspend football could cost the league millions, but the decision is receiving support from those within the game.
What happens if one or two of players contract this problem? And unfortunately it's happened in the last 24 hours, so I can't see any alternative than to suspend it and see where we are in a few weeks.
France's top league has also been halted till mid-April, adding to a growing list of suspended competitions, including Spain, Italy and Portugal's top divisions.
Training sessions will continue because we don't have a date yet to know when the championship will resume. But we have to continue training while taking precautions for the players and the people who are still here at the club.
Games had been due to be played behind closed doors in France. The problems with that policy were highlighted when Paris Saint-Germain fans gathered outside their stadium on Wednesday for a European match in defiance of the order. That game was in the Champions League, which itself has now been suspended indefinitely. Europe's governing body UEFA will meet on Tuesday to decide what's next for football across the continent. Sohail Malik, Al Jazeera.
Major sporting events have also been cancelled in Australia as the government there is advising against large public gatherings. People are also being urged to avoid any non-essential overseas travel as health officials say millions of people could become infected in the coming months. Nicola Gage reports from Sydney.
Some had been waiting for hours before the decision was made that Australia's Formula One would not go ahead. Many are angry they weren't told sooner.
They're just doing such a bad job at communicating and at everything.
Earlier, McLaren pulled out after one of its team members tested positive for coronavirus. Formula One champion Lewis Hamilton accused organisers of putting money before health if the race wasn't cancelled.
We're terribly disappointed that the event can't go ahead. The reasons for that are well known.
Spectators were banned from watching the one-day international cricket match in Sydney between Australia and New Zealand, which meant an empty stadium and cash registers. On Thursday, the government was still advising people to attend public events, but in an effort to fight the virus and after pressure from health experts, that quickly changed.
We will be advising against organised, non-essential gatherings of persons of 500 people or greater.
The Prime Minister also told Australians not to travel overseas if it wasn't essential. With financial pressure on the aviation industry, travel agent Flight Centre collapsed, closing 100 stores across the country. The number of job losses isn't clear, and Virgin Australia is cutting flights to cope with the falling demand. The number of coronavirus cases in Australia is continuing to rise, and no surprise, it is hitting the economy as well as the share market, with stocks plummeting. The Australian government has announced a $17 billion stimulus package, handing out $750 payments to some to try and prevent a recession for the first time in 29 years. Among those in Australian hospitals with the virus are Hollywood actor Tom Hanks and his wife Rita Wilson, as well as the nation's Home Affairs Minister Peter Dutton, who will no doubt now have to work from home for a while. Nicola Gage, Al Jazeera, Sydney.
And our sports reporter and presenter Andy Richardson joins us now from Doha. And in the past few minutes, Andy, the London Marathon has also been postponed. Can the sporting season get back on track anywhere this year?
It's looking unlikely. We're going through unprecedented times, really. The London Marathon, for example, was meant to serve as for UK athletes at least as a time trial ahead of the Olympics. And I really think at this stage it's more interesting to look at the outliers rather than what is actually being called off. Two events, one that's going on, just finished in the UK at the moment, the Cheltenham Horse Racing Festival, which within the UK is one of the biggest sporting events there is. Around 250,000 fans will go there over 4 days, and at a time when we're being told to be aware about social distancing, keeping our movements outside of our house to a bare minimum, it's somewhat incongruous to see a gathering like this and sort of almost looks like the last days of Rome before we do head into this period now where there's going to be next to no sport. And in terms of the Olympics, that is the other thing that at the moment the International Olympic Committee appears to be singing a very different tune to everyone else, saying that as far as they're concerned, the Games are still going to go ahead in July in Tokyo. We saw over the last couple of days the torch relay start in Greece at the sort of spiritual home of the Olympics there. As of today, the torch relay has had to be suspended because they're worried that too many people were coming to see the torch relay, even though they'd encouraged fans to stay away from that event. But despite that, they're saying the torch will go to Japan at the end of this month, that a scaled-down torch relay will take place around Japan over the next month or two, and that as far as they're concerned, that the Games will take place as planned and start on July the 24th. We shall see.
Thank you very much, Andy Richardson in Doha. Thank you, Andy. Still ahead. With French local elections going ahead despite the coronavirus, we look at how politicians are changing the way they campaign. America's strikes missed their targets in Iraq, killing 6 people and increasing tensions with Baghdad. And then in sport, the Olympic flame is snuffed out because too many people want to see it.